Okay, good. Now, we are continuing with our lectures today about echocardiogram. And today we are talking about the thoracic, transthoracic echocardiogram. And we will start with our main topic today is parasternal wrong axis. So when you're doing a transthoracic echocardiogram, there are three main windows which you should remember. And the one is called parasternal window, the other one is called apical window, and the other one is called subcostal window. Now, the parasternal window, it is on the left side of the sternum, immediately the left side of the sternum, in 3 or 4 intercostal space in between that space. And the other one is this one visualizes the major part of the heart, and you see them. Then the other one is the apical window, and the apical window is just below the breast, just below, focusing towards the shoulder, and the other one is the subcostal. The subcostal, which one visualizes the inferior vena cava. It also visualizes the importance of this subcostal is to visualize the inferior vena cava. It visualizes whether there is pericardial effusion, and also it visualizes whether there is a pericardial effusion. It also checks the other things like the respiration in the inferior vena cava. So our major area is about parasternal wrong axis view. Now, the parasternal wrong axis view, this one focuses on various part of the heart, like mitral valve, aortic valve, all those ones, the left ventricle, the left atrium, all those ones. So you check on them. So these are this one that you check, you put your transducer at the left sternum border in the 5th, 4th intercostal space, and it has to point towards the right shoulder, towards the right shoulder, towards the right shoulder. That is where the transducer should point. So be point. So if you want to visualize the cardiac chambers, the heart chambers, you have to put the optimum depth. The depth, you have to adjust the knob on the ultrasound to 12 to 16 centimeters, 12 to 16 centimeters if you want to visualize the heart chambers using parasternal wrong axis. The other one is if you want to visualize the pericardial or pericardial effusion, you put the same, you don't move the cursor, it is at the 4th, 5th intercostal space towards just towards the right shoulder. Then you adjust the knob of about the depth, then to 20 to 24 centimeters. This one you will be able to visualize the pericardial and the pericardial effusion very well. Now, in this parasternal axis, we want to see what do you see in this parasternal wrong axis. You remember very well that you have said that the parasternal wrong axis, you put your cursor at that 4th intercostal space towards pointing towards the right shoulder, and then you have to see various things at that. And you will see that this one will be able to see various parts of the heart. You'll be able to see various parts of the heart. You'll see the left ventricle, you see the right atrium, you see the mitral valves, the anterior and posterior cusps. You'll see the anterior ventricular valve. You'll also see the aortic outlet flow. You'll see the ventricular outlet flow. Also, you can be able to see the condyle and also the papillary muscles. If you test this, also you'll be able to see the anterior aspect of the left ventricular wall and the posterior aspect of the left ventricular wall. Also at this point you can be able also to visualize the descending aortic, the descending aorta. You'll see this was how you are going to visualize them at that one. So at this point you see that this is the This is the left ventricle. You see, this is the left ventricle. This is the right ventricle. This is the intraventricular septum. This is the intraventricular septum. This is the intraventricular septum. Then this is the left ventricle outflow. This is the aortic outflow. This is where we get the valve, the aortic valve. This is where you get the mitral valve. The mitral valve. This is the papillary condyle, and this is the papillary muscles. This is the inner anterior aspect of the left ventricle, the posterior aspect of the outer aspect of the posterior part of the left ventricle. This one you see here is the outer part of the left ventricles, and this is this one. This one is the descending part of the aorta. This is the descending part of the aorta. This is the descending part of the aorta. So if you can be able to visualize these ones, then at least you are somewhere in terms of along parasternal axis view, along parasternal axis view. Now, this one is used to you have seen that it can be able to used to measure the size of and the functions of the left ventricle. This one we'll discuss them later. We will be talking about the andrometric, the andrometric measure of the rat. So it is used to measure the left ventricle, the right ventricle size and functions, the intraventricular septum, the ascending aorta, the aortic valve, the mitral valve, and the pericardium in the presence of effusions and also perineal effusion. So those are the things you check in this part of parasternal long axis. The long parasternal long axis is all this what you see in this. So the various pathologies you see in this parasternal long axis, you will be able to see whether there is a right ventricular hypertrophy. You can be able to see the left ventricular hypertrophy, whether there is a septum, intraventricular septum defect, or if there is a stenosis of the ascending aorta. You can be able to see also the aortic valve prolapse and the stenosis. If there is pericardial effusion, all these ones you'll be seeing this one in a long axis, in a parasternal long axis. Parasternal long axis, you'll be able to visualize these things. Now let us look at parasternal short axis. Now, still you have your cursor at your cursor. Still, it is located at 4 intercostal space on the left part of the sternum. Then you rotate it 90 degrees towards the right, towards the left shoulder. The moment you rotate it at that point now, at this one, you are now on the short axis view of a parasternal window. So in this case, now you'll be able to see the aortic valve. Again, you'll be able to see the left ventricle, the mean papillary level, the papillary, they are the ones which hold the valves. And for this one, you'll be able to see the mitral valve and the aortic valve. For you to be able to see these things, the depth, you adjust the knob of the depth to 12 to 16 centimeters, 15, 16 centimeters. So there is 3 views from parasternal windows. Parasternal windows has 3 views. You can see you can view by just moving with the knob in the transducer. You can be able to visualize the aortic valve. You can be able to visualize the mitral valve, and also you can be able to visualize the mid papillary muscles. Now, in this case, now you can see that in this short axis of parasternal, you will be able to see the tricuspid valve. You can be able to see the tricuspid valve. You can see the aortic valve. You can see the aortic valve, which has 3 valves. And in this case, you can be able to see so many things about this aortic valve. We will discuss aortic valve specifically as a topic later on. So you can be able to see the pulmonic valves, the right ventricular outflow, and then outflow tract. Then there is that visualization of the mitral valve. You see the left ventricle, the mitral valve, uh, the intraventricular septum, and the right ventricle. This is what you visualize in this in this type of along parasternal axis. You can see the mid papillary muscles. The papillary muscles, you can see them. You can see them, the right ventricle. You can see the papillary muscles. Then you can see this one is what you see in these examples uh, of parasternal axis. So the parasternal short axis will be able to assess the left ventricle size and function. So you can be able to see it in the right ventricle size and function, aortic valve, mitral valve, and the presence of wall motions, abnormalities, and the presence of wall abnormalities. This one tells whether there is ischemic heart disease, because this one is going to talk about dyskinesia, hyperkinesia, and dyskinesia, hyperkinesia, or hypokinesia, depending on the pathology on the walls. Okay, on the pathology of the walls. So the other one is that we are going to look at the apical four chambers view of the heart. So the apical, this one, you place the transducer at the apical impulses at the apex of the heart. To the left nipple just need to more lateral in some patient. So on the just inferior to the left nipple, just inferior to the left nipple, it indicator point towards the left flank, approximately at the point of 3 o'clock. Approximately at the point of 3 o'clock. At the point of the 3 o'clock. At the point of 3 o'clock. Okay, point of the 3 o'clock outward. Then in this depth, you have to give it a depth of 14 to 18 centimeters so that you can get a very good visualization of the apex. Of the apex chamber, beyond chamber. In this one, apical chamber, you'll be able to see the four apical chambers of the heart. They are called the four apical chambers of the heart. In this one, you can see. Remember that the ventricles are on the top, the atrium on the lower part. In this one, you can see the various aspects of this window. You can see the left ventricle, you can see the right atrium, the mitral valve, the right atrium, the left atrium, the tricuspid valve. You can see the tricuspid valve, and also there you can see the aortic outlet. You can be able to visualize the aortic outlet. You can be able to see the intraceptor, the atrium septum, and also ventricular septum, and also in ventricular septum. You can be able to visualize them. So there are four chamber, the four chamber view. I will be able to assess the left ventricle and atrium, right ventricle and atrium, aortic valve and mitral valve and tricuspid valve, all of them. So the other one is subcostal four chamber view. The subcostal four chamber view. The subcostal four chamber view is that you place the transducer 2 to 3 centimeters below the sternum. The sternum, this one directly to the it is directly towards the left shoulder, and this one approximately proofs will be directed towards the left shoulder, approximately 3 o'clock. And the optimum of the 16 to 24 centimeters, you will be able to visualize various things. You'll be able to visualize various things. You'll be able to visualize the liver, part of the liver up there. You'll be able to visualize the left ventricle, the right ventricle, the right atrium, the left ventricle, and the mitral valve, tricuspid. Then also the diaphragm is there. You'll be able to see the diaphragm. In that case, so in this case, you'll be able to see the precandium, tricuspid valve, the mitral valve, and the left ventricular, and atrium, and the left ventricles. Again, in this one, you can be able to see the inferior vena cava. Now, the subcostal inferior vena cava is another view. This one is the one you'll be able to see it very well from the subcostal fourth chamber. From the subcostal fourth chamber view. From the subcostal chamber fourth view, you rotate there. Remember the subcostal fourth chamber the subcostal fourth chamber, when it is still there, you will be able to visualize rotate the tricep 90 degrees clockwise so that it faces along the sternum. The probe will indicate towards the 12 o'clock, and important to see the intraventricular, the inferior vena cava merging into the right atrium. That is what you'll be able to see. So the inferior vena cava, you can see it there. The inferior vena cava, you can see it there very well. You can see the inferior vena cava coming there, feeding the right, then emptying to the right atrium, emptying to the right atrium. Then the part there is the liver, so you can see it how it looks like. So the inferior vena cava measure diameter is 2 to 3 centimeters in a normal person, and to the left it's what the intraventricular and right atrium junction. Spontaneous ventricular patients and intraventricular collapse, intraventricular inferior vena cava collapse of greater more than 50% during respiration cycle is strongly predictive of low atrium pressure of less than 100 milligrams per mercury. So mechanically ventricular patient with the inferior vena cava respiratory variation is a good predictor of prolonged responsiveness. So small inferior vena cava of less than 1.2 as unread specificity but low sensitivity to a right atrium pressure of less than 10 milligrams per of mercury. So this one is very used when you are giving to tell you why how are you giving this fluid. Then we are giving this fluid. So this is how this one tells you what you are giving in this type of patient. Now, thank you very much for listening to this one topic about various views. Therefore, the reviews of the reviews of the parasternal view, apical view, and subcostal view. And you have seen that the summary is that the parasternal view, window view, fourth field intercostal space, left of the sternum, towards the right shoulder. You'll be able to visualize left ventricle, left atrium, the mitral valve, the pulmonary outflow tract, the pulmonary valve. You'll be able to see the inferior, the descending aorta. You'll be able to see the apical part, the inner part of the apical of the heart. So the apical window, you'll be able to see the four-chamber heart, and also you use it again to see and also subcostal window, where you will be able to see it. The importance of subcostal window is to visualize the inferior vena cava. Thank you very much for listening to this one. You'll see now the various pathologies when you have doing this type of ultrasound. Thank you very much.